There is a reason that behavior therapy tends to be recommended alongside behavior medication. So, behavior medication is considered a first line of defense. When we have dogs who are experiencing chronic dysregulation through anxiety disorders, trauma disorders, hyperarousal, hypoarousal, or they're experiencing chronic stress in their environment, behavior meds should not be a last resort. They shouldn't even be, halfway down the list. They are a first line of defense. And that's because we are looking at a physical health concern at that point. And yes, it's also an emotional health concern and therefore a behavioral health concern, but it's also a physical health concern. Chronic stress is not good for your body, and it changes the way your nervous system, as well as a lot of other parts of you, functions. And so the role of behavior medication, generally speaking, is to take stress levels that are baselining at a higher than ideal level and help to lower them, and to help increase the dog's resilience to stress so that they're not getting taken down for hours or days or weeks or sometimes months by stressors. Behavior therapy also does those two things. Part of the role of behavior therapy is to help reduce baseline stress levels. And we do that in the immediate through management, but we're also looking to do that in the bigger picture so that we can reduce management over time. Behavior therapy also helps to increase resilience. And we do this in a number of ways, but one of, I think, the most important ways is through increasing the dog's agency. And that's just one example of something we do in behavior therapy that's not being replicated through behavior medication. The medication is working together with the behavior therapy to lower the baseline stress levels to increase resilience. But behavior medication isn't changing emotional responses and associations. It isn't teaching skills. It isn't repairing relationship. It isn't designing an enrichment plan for the individual dog where they are currently. It's not collecting data to investigate physical health concerns in the dog. There is a lot more to increasing the well-being of a dog who has chronic dysregulation concerns than just the behavior medication. So absolutely, it is a first line of defense, but ideally, we are connecting that with behavior therapy. Now, perfectionism is the enemy of progress, and so if for whatever reason someone can't engage in behavior therapy at the time, it can absolutely still be worth investigating behavior medication. We can still significantly enhance the dog's well-being, even if we can't do everything all at once. But ideally, we are combining behavior therapy, investigation into physical health concerns, and behavior medication.